Well, every program has their own different views on GPA. At UK, without divulging the exact percent that we might or might not consider it, it's definitely a piece of your application. I find our program has a GPA cutoff of 3, so if you have less than 3, then generally we do not review your application.
Okay.
That being said, I think there are a lot of other things that are really important, more so than GPA, certainly as far as the application goes. But even when you're considering grades, there are probably classes or experiences in school that translate more towards your likelihood of being a high functioning resident than others. So if you have poor grades in classes that translate well to your clinical knowledge, then that might be something that we would look at more so than your flat GPA.
So GPA is on our pre-interview rubric. In phase 1, it counts for 6.5% of the total points available. In phase 2, it counts for 13% of the total points available. That being said, we definitely look at more than grades. A 4.0 does not even automatically guarantee you an interview. We think that a student with a 3.5 who worked during school or who has a lot of leadership experience definitely stands out more to us than a 4.0 with nothing else on their CV.
So when we review our applications, we have a scoring tool that we use, and GPA is a component of that. And there's grading where you get more points if you have a higher GPA. But our program does not have a cutoff where we don't review applications if you don't meet a certain GPA. So it's definitely factored in, but it's not the end-all be-all.
Well, I think that what really helps the application really is trying to help the program directors predict who's going to be successful.
Okay.
So what you want to see on any application are things that help you understand that the student has already done things that a resident might be asked to do, or at least has been in that ballpark, right? So the APPEs that stand out are APPEs that sound like they're residency rotations.
Sure.
Inpatient clinical experiences in internal medicine or pediatrics or oncology or critical care, or all the different types of rotations that you might see on a resident schedule. But then students often have the ability to do a lot of really different things. They might be able to go international. They might be able to do academia or teaching rotations. They might be able to go and spend a month at ASHP. And all those are really cool experiences that you can really gain a lot from as a student. From my standpoint, that's fine. If you did that, that's great. If you don't have a story to tell, if that doesn't make any sense with the rest of your application, then it doesn't matter as much to me. But if you've been to ASHP, for instance, for a month, and you want to be a leader in the profession, and you've got stories about what you learned and the perspective that you got from that rotation, and you tie it directly to where you're going in your career and how my residency program can help you get there, well, now that's something that's a little bit more meaningful. So just having it on paper is only half the battle. Making it applicable and helping program directors understand how it fits in your career plan is probably the more important aspect of those things.
So we have some preceptors that look specifically at therapeutics grades. That's very important to them. When it comes to APPEs or other experiences, we like to see some community hospital experiences, since we are a community hospital, and we want to make sure that the student knows what a community hospital has to offer and that they actually want to be with us. So we like to see some sort of experience there.
Also on our scoring tool, we do look to see if you have hospital-based APPEs factored in. I know, it certainly depends on what your college or school requires as well. And if you aren't able to have one or more APPEs in a hospital-based setting, then we would look at your work experience, because that also provides, another facet of giving you that hospital experience. So if you were an intern or technician during or before pharmacy school, we would look at that as well. It's having a variety, not concentrating in one area, making sure you're getting a variety of APPE experiences as well.